Hello, thank you, and thank you ACM for having us here. Like you said, my name is Ritu Gyawali, and today I'll be talking to you about my research and how it affects, how it's connected to my life and my career goals in general. So, I have been involved in the medical field since high school. I went to Gyawali High School for Health Professions, so the name in and of itself, we studied medicine, but at the same time we also went to the hospitals, and there we got to see one-on-one interactions between doctors and patients. And that's where I really saw disparities and saw how language and culture barriers affects the doctor-patient relationship. So when I was looking for a study abroad program, I really wanted both these aspects, health and culture and language together. But I couldn't find any such program up until I ran across a poster that said comparative healthcare in Costa Rica. So then I contacted Robin Reagan, and even though I didn't do this particular program, within that same year I was in the streets of Costa Rica, just Spanish, no English, or Nepali, which is my mother language, and basically had to learn the language. So the ACM Costa Rica program, the trimester is split into 3 parts. The first month we research about our topic, and I researched on skin cancer. So why is it important in the Costa Rican population? It's the most common type of cancer there, and given that Costa Rica has a tropical environment all year round, the Costa Ricans, the peoples, are exposed to this high amounts of sunlight and UV radiation since early childhood. The Costa Rican population, most of them are of fair skin color, and also the Hispanic population compared to their Asian counterparts of similar skin tone have a higher risk of getting skin cancer as well. So I really wanted to know what does the Costa Rican population know about the adverse effects of sun exposure, and although I could have explored the whole population, I restricted myself to a tiny area in the Pacific coast of Costa Rica for the time that we had there. And so the next month I was in my rural stay, sleeping on hammocks, eating fish, and I was riding the quadricycle with my mom selling cheese around my host town. And also I did my research there. I interviewed subjects 18 years and older in Jaco, which is a very touristy spot, Gyawali, which was my homestay, and that's my mom with cheese, and Puntarenas, which is a hotel and resort. And I used a survey to conduct my interviews, and most of them were in Spanish. So the survey consisted of 4 parts: the demographic information, their knowledge about skin cancer related questions, and their practices as well. And then the next month I was back in San Jose in the urban lifestyle. I interviewed 315 subjects, and like I said, most of them were in Spanish, so a lot of Spanish practice. And so what did the Costa Rican population know? 89% of the population was able to cite that skin cancer is an adverse effect of sun exposure, which is great. When I asked, is sun exposure harmful? 97% of the population was able to say yes, which is great, but it was most significant based on the differences in age groups. So this chart, this way is the percentage of yes versus no, and then this way is the different categories and the percentages. So the younger the population, the more likely they said, and the older population wasn't able to cite yes as much. And when I asked, is it harmful even on cloudy days, this was most significant based on differences in education levels. The higher the education, the more likely they said yes, which is the correct answer. It's still harmful on cloudy days. 35% of the population still said no, so there's some knowledge to be shed there. When I asked the same question, what are some adverse effects of sun exposure on a person, we're just going to focus on skin cancer. Like I said, 89% of the population cited skin cancer, and this was most significant, again, with differences in age levels. And the younger the population, again, were able to cite skin cancer versus the older population wasn't as able to. I also came up with a knowledge score for the question, what are some possible causes of skin cancer? And I rated it from 0 to 5, and there were a multitude of answers given, so I just summed up all the answers they gave, divided by the total number of answers, and got the final score. So I divided it up to like 5 being UV radiation and 0 being they didn't answer, or they just gave me the wrong answer and they just said no, there's nothing. And the results for this, again, a similar pattern. The higher their education, the higher the knowledge score. So in conclusion, it was great to know that a good percent of the population knew that skin cancer is an adverse effect of sun exposure. However, there's still knowledge and awareness that needs to be made throughout the community, especially with the lower education levels and the senior population. And my research really set a foundation for sun exposure and the adverse effects of sun exposure and skin cancer related research in general. So hopefully with more investigation in the future, we can know more what the community knows, and then in that way we can serve the community better and create education programs. So why does all this matter? Going back to the slide that I showed you earlier, the American medical system is reforming currently. We want to look at a patient in a holistic view, not just the patient when they come into the hospital in your bench, but you want to look at the patient when their whole life, like what do they do as living, what's their family life like, their socioeconomic status, their education levels, and all of the factors that I used for my research. And so the bigger picture for me, throughout my high school and throughout my Knox career, I have really devoted and wanted to learn about the underserved community within the medical field. And the underserved community consists of a large number of Spanish speakers. So not only did I get the opportunity to build my Spanish skills and also learn the culture of a particular Latin American country, but also with my interviews that I conducted, I had a first-hand into seeing how education levels and how the different demographic factors, socioeconomic status, gender, and age, all this factors into what a population knows about healthcare and what they bring into an office when they do come in as patients. So after Knox, I will be going to Wake Forest University in the program Intercultural Services in Healthcare. So this study abroad opportunity definitely helped me get this graduate school program, and I also want to thank Gilman, without which I would not be able to go to study abroad. And also I would like to thank my host family, my study abroad companions, and the ACM staff there, Mario, Alejandra, Yvette, and my advisor, La Doctora, as we called her. Thank you.